So I'm here in Central Park again, getting some sun, enjoying the warm weather that has blessed us out of nowhere. 60 degrees. Still concerned about the coronavirus. Still a lot of apprehension and anxiety when it comes to that. Whenever I'm on the train and I hear somebody coughing, I immediately start to get concerned. I start to move away if they don't cover their mouth. Just trying to do what I can to avoid getting the infection. I know that it mostly affects older people, so people around my age bracket shouldn't be that much at risk. But those with lowered immune systems are at risk. I think my immune system is fine, but if you have diabetes or I don't know, any kind of lung disease or something like that, you're at risk since it is a respiratory infection. So, I think sometimes I have to wonder, is this like just a lot of manufactured fear, or is this like how serious is this? Because as we've discussed in previous videos, the flu kills thousands of people every year. In just this country alone, worldwide, Corona has killed 3,000. Some say it was probably spreading around before it was discovered in Wuhan. So maybe some of the people who died from the flu actually died from Corona. Who really knows? There's scientists saying that this thing might be man-made. Maybe it could be a precursor to something else. The biggest concern, I think, is the capacity for government to take the reins over all levels of society. Even the World Health Organization, the number one organization basically leading the PR campaign against Corona, or basically releasing news on Corona, those guys at the WHO, the World Health Organization, they're praising China and they're saying that government should act from the top down and basically administer authoritative controls.
The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. In many ways, China is actually setting a new standard for outbreak.
Authoritarian controls over the populations. What else can you gather from that if they're saying that China is actually doing a good job in containing the virus, but in the meantime they're violating people's rights and probably killing a bunch of people that didn't need to die? Anybody with a symptom, you could potentially get sent to an incinerator and get cremated, according to some reports out of China. Hand sanitizer and masks continue to be hard to find and expensive, still going up in price. The big thing is that a lot of these items are created in China, like hand sanitizers. So now might be the time to look at supplies that can also sanitize your hands or also sanitize your environment, and try to stock up on those before those disappear. There might be ways to create your own hand sanitizer. There must be an easy way to do that. I'm definitely going to hold on to my travel size sanitizers and then refill them with with something. I was looking for bulk hand sanitizing liquid, and I managed to order something, but it got canceled. I ordered like a gallon of hand sanitizer, but like the foam making one. So I don't know if that would work with the travel size hand sanitizers that I have. But I've got some masks, like I said before. I've got some sanitizer. But if this is going to be a continuous thing, we're going to need new manufacturers in other parts of the world creating these things. And, of course, China's economy is going to get hit, but they can recover. The rest of the world, though, it's not looking too great. It's just the number of cases seem to be exploding, at least like 10,000 new cases a week around the world. And it's already well over 3,000 deaths worldwide, and the number just keeps ticking up and up. But the situation with the economy is that a lot of people depend on the supply network from China. They depend on those factories, and how are we going to get these things put together in a cost-effective manner? It's going to take a long time for the infrastructure to work itself out. And in the meantime, there could be as many as millions of deaths, according to some estimations, that it can go up to 16 million deaths. And that's assuming that everybody gets infected, and I'm sure that not everybody will, because there's more isolated places, and that the spread probably won't hit as hard. But right now there's reported cases pretty much on every continent except Antarctica, and there doesn't seem to be any containing it. The United States still not really screening people. I read an article that said that at the time that I read it, they said that maybe like 3,000 people got tested in the United States, which obviously is not a lot. And in South Korea, they're testing a bunch of people. But apparently the CDC needs to approve a certain test. But the test that they're waiting to get approved is already being used in other countries right now. But I guess the argument for that is they gotta make sure that they're effective with their testing. But I don't know. In New York City, everybody gets packed onto the train, and a lot of people are still kind of oblivious or don't care about Corona, like still coughing out in the open air and still getting unnecessarily close to people. Like, I don't know, maybe I'm some kind of a germaphobe, but I always never really liked standing next to people or being right next to people unless I really had to. In New York City, you do have to at times, but not every single time. So I'm just doing what I can to just stay stocked on water as I'm going, continually using water, of course. So I just want to make sure I at least have a few gallons spare at any given moment. But they're limiting the amount of water you can order off of Amazon, and I haven't really checked the local supermarket as far as water, but definitely sanitizer is sold out in the neighborhood. And they're selling like hydrogen peroxide for like $7 a pop, which seems kind of excessive to me. I think they used to be like a couple dollars, but yeah, a lot of cleaning supplies are getting sold out, and they're not in stock anymore. It's hard to find these things. So just do what you can, like go to your supermarket, stock up on whatever you can. I would say your goal should be at least to have a month's supply of food and water and medical supplies, including flu medicine, things like that. You want to avoid having to go to the hospital in this time, because the hospitals are full of sick people and they don't know exactly how this virus spreads. So you could go to a hospital and end up getting sick. A lot of health workers are stressed out. A lot of TSA are stressed out because they're around a lot of people all the time, and they know that this country isn't testing people like they should be. People are getting off of flights from South Korea and they're not getting tested, and it's kind of like left up to them whether they want to quarantine themselves or whatever. And as many people have noted, is that in the United States, you got to work to survive. There are people living paycheck to paycheck, people in part-time jobs like myself, or in contract jobs, people working off tips, and that will definitely be hurt if they miss a week of work, or if they miss a month of work. They could end up homeless. Thankfully I have some support, and but if I didn't, I might be homeless right now. And basically anybody could be a couple of checks away from homelessness. I mean, a lot of people in this country are like that. They don't really have savings. That's just the reality of the situation. So I'm going to keep it real with you. Like, reality is rough. This world is rough, and civilization is just really like a thin veil that's covering the savage planet, that humanity blossomed out of. So don't depend so much on the government or the current infrastructure, because the current infrastructure might not exist years from now or months from now. You never know what this could cause, especially economically. That's a big concern, because if the economy crashes globally, then we're really in big trouble. Forget a virus. That would be nothing. But definitely the virus is a concern for those with lowered immune systems and older people. And there's a lot of people with chronic illnesses in this country as well. So you got to make sure to take more vitamins and stock up on medicine. If you know you need medicine, try to stock up on it. And that's all for now.